thanks a million. Thanks to the HRB for inviting me here today. I think it's really reflective of the collaborative conversation that's going on to hear all the views in the room, and just the design of the agenda today really reflects that. So all credit to the HRB for that. I'm very privileged to come here and give an industry perspective, and in doing that, I work for one company that's part of a sector, but I think there's, multi-sector industry involvement and interest in this space, and in, driving change and driving any incremental benefit that we can see out of delivering meaningful personalised healthcare. We've spoken a lot today about the critical, challenges facing global healthcare. Ageing populations, urbanisation and population migration are all adding to the rising cost of care. Ireland is not immune to this, as we've heard today. There's been a doubling of cancer incidence from 2019 to 2045, or to 2045 alone, and an expected increase of spend of 800% per capita in healthcare spend between 1995 and 2019. As this is all happening, we know we're in the information age. There's an explosion of information and data. Staggering figure, medical knowledge is doubling every 73 days. That compares to every 7 years in the 1980s. And this is providing increasing challenge for healthcare professionals when they provide care. Just some examples are more than 8,000 clinical practice guidelines have been published on PubMed since 2015. A quadrupling of registered clinical trials, from 100,000 to 400,000 in the last 12 years, and 60,000 clinical trials are currently recruiting globally. Patients are changing their practice. We've heard that today. Patients are more informed, and they're demanding a higher quality of service. A US study found that 60% of patients' questions go answered because physicians just don't have the time to answer them. Speaking to a friend who's a colleague who's a medical oncologist recently, he shared with me that he feels that in the next 10 years, he'll have to de-subspecialise a tumour type every 2 years just to keep up with the medical knowledge, the pivotal knowledge in the tumour type, and also to be able to deliver the standard that's expected of his patients. So how can data help to unlock? How can data help to unlock and advance patient care in this space? How can we harness this information and technology to be able to deliver the patient care that we want for individuals and for society? At Roche, we believe that personalised healthcare is the confluence of science and technology with patients at the centre. And we apply this to our research and development by taking insights, and as you can see on the left, applying advanced analytics like AI, like neuro-linguistic programming, to things like clinical trial data and regulatory grade, good quality real-world data, to be able to help us make better, easier go, no-go decisions on clinical trials, to develop faster, more efficient, adaptable clinical trials that serve the patients better, and to be able to uncover deeper insights into disease. And when using the computational technology that's available, we believe that this can be transferred into the clinical pathway as well on the right. Using data as an engine, we can deliver early, accurate, timely diagnosis using a plethora of technology, including digital pathology, including advanced imaging, including genomics, liquid biopsies, multi-omics, to better define patient populations, to provide accurate, complete and timely diagnosis when it's needed. This can feed into developing personalised care plans tailored to the patient's need, and treating patients with novel targeted personalised treatments, and moving to the space where we can start to personalise predictions of disease as well. And then this data driving a learning loop that can benefit society as well by providing optimal access at the right time for the right care intervention for patients, delivering faster, better decisions on safety, efficacy, and driving value back into the system, avoiding patients being treated with interventions that are not benefiting them. And bringing this into patient monitoring, that if we're improving routine monitoring and symptom management, and we can start to even look at things like patients' real life experience to deliver that holistic approach by looking at things like patient reported outcomes, patient reported experience measures, and being able to drive better decision making back into the system by harnessing all that data. I know it's ambitious, but as we said today, we have to have an ambitious plan. And with this, Roche believe it's possible to deliver twice as many medical advances at half the cost to society. And we're serious about that. It's our corporate vision. But what are we going to do to make it happen? What are we doing to try and help healthcare systems to address some of these challenges? Just a few examples I'll give you. In Australia, we've worked with the Government of Australia to design a first-of-its-kind study co-funded by Roche and the Government of Australia to look at establishing personalised approach for treating non-small cell lung cancer. And this has helped to establish evidence frameworks that can guide the assessment for molecularly guided therapy options in Australia. In Canada, we're looking at real-world data frameworks, some of the federated data learnings that we were talking about earlier on. A group called CFIN, which is an academic group looking at research and driving regulatory grade real-world data that can be used in better decision making. In Norway, which was mentioned earlier today, we're working with many other companies as part of a public-private partnerships in a group called Connect that's involved with the National Cancer Precision Cancer Initiative over there. In Ireland, when we look at all these challenges in the health system, we have to use almost a personalised approach per system. And in Ireland, we came together in 2019 to see if there was anything that we could do to help address some of the challenges that healthcare professionals and patients were facing. We threw out a wide net, and we brought a group of people together, including, importantly, the patient voice, with a patient advocacy group representing Cancer of Unknown Primary joined us. We went into a room and had a very awkward ideation session, which involved Lego, let me tell you, and a couple of professors. But we all agreed to go into the room and leave our allegiances at the door, to leave the politics at the door and just talk about what's the current state, what's the ideal state, and what's possible. So there was a couple of things that came out of that, but in co-creating a centralised national molecular tumour board programme to look at, to help doctors when they receive these genomic reports for patients to be able to interpret them and make decisions from them. So that was one of the outcomes of the ideation session. We then went to as many stakeholders as we could, really, including the HRB, to say what we were doing. This is just really demonstrating a way of working and how we did things. We co-created a pilot, we co-designed a workflow and a legal framework to support it, and we conducted a virtual molecular tumour board in the middle of the pandemic. We extended it for 6 months, improving and iterating as we went, and we had an operations partner to help us with it. It came with a lot of positive feedback, and at the end of 2021, Cancer Trials Ireland approached us to get involved in a collaboration because they saw the benefit of being able to identify patients that may be eligible for their clinical trials in Ireland. So we signed a collaboration agreement with Cancer Trials Ireland. And really just to show our partnering approach, we piloted a solution as we could, an educational insights generating solution. It was limited, it wasn't a full integrated service, but it was an educational pilot. We evolved it, supported by a robust governance structure with Cancer Trials Ireland, and now the vision is that this can be taken by Cancer Trials Ireland and integrated as a validated clinical solution for patients. So we were catalysing something in the system. We had a paper published at ASCO this year, if anyone wants to look into it. And so when we talk about who benefits from collaborating together, what's in it? We've heard many points of view today. When we know that patients benefit from increased access to timely and effective, more personalised care, more holistic care, we've heard it today, while ensuring privacy is protected and personal data are secure. Providers are already recognising the importance of interoperable health data, supported again by good governance and infrastructure and legislative frameworks that support it, to deliver patient-centred personalised care, including linked EHRs, genomic, organic data, and even social determinants. Regulators are ensuring safety and efficacy of health technologies while reliably generating usable real-world data. And there's an opportunity to use this real-world data to drive decision-making and health technology assessment too, to ensure the financial sustainability of healthcare systems, while being able to tailor interventions to patients' unique profile to increase responsiveness, decrease side effects, and also potentially reduce waste in the system that can be reinvested. And policymakers are focusing on health and wellness of citizens while ensuring that the legislative frameworks exist to ensure privacy and security of health data. We know the world of the future will be driven by our ability to harness the potential of this data explosion. And we've seen the challenges today, and we've seen the opportunities and the benefits of delivering personalised healthcare or enabling personalised medicine through personalised healthcare or vice versa. I guess the call to action is to find the coalition of the willing that are willing to come together and make something happen, to have the conversations and to put the frameworks in place to be able to make incremental but meaningful changes in the future.